All right, welcome to our Lunch and Learn. Dave Tranquita, owner of ProCare Physical Therapy. Today we're going to be talking about dry needling. Again, there's a lot of interests out there, what it is, what it does, and how it can help patients who are in pain. So first off, what is dry needling? Dry needling basically uses a filament needle, very similar to acupuncture needle. It's not acupuncture. Again, I call this Western medicine, where acupuncture is Eastern medicine. We don't use meridians, reflexology, or looking for changes in qi, which is energy flow. We're basically just finding a tight muscle that has a trigger point in the muscle, which is basically a nodule or a knot that's causing pain or radiating symptoms down the arm, in the neck, shoulder, or whatever area of pain that you're getting. Again, when you come to ProCare Physical Therapy, we do a full examination to look to see what is the cause of your problem, give you a diagnosis, and if you do have a myofascial problem, trigger points, again, dry needling may be indication for part of your treatment. Now, when we do dry needling, we want to make sure that we're prepping the patient. We're going to be using alcohol wipes to clean the area. And again, using the filament needle. Again, what we're going to be doing is looking at this patient's upper trap. So we want to find the tension point. So there's where that tight spot is. I'm going to actually be coming through this direction. So the needle is in. Again, you don't feel the needle go in. What you feel is the muscle contracting. Now, I don't know if you can kind of see that contraction. And I move the needle around kind of like what I call telegraphing or pecking. And basically what we're trying to do is release that muscle. Now, myofascially, what we're seeing is there's a mechanical change and a biochemical change. So when you have a knot, the muscle is ischemic and hypoxic, so it's not getting good blood supply or oxygen. As I push the needle in, it drops calcium, that's the chemical change, sends a signal to the brain back to muscle to relax, so you get the contraction or a twitch response. Then the muscle lays down. After the dry needling, then we can do some soft tissue, massage, stretching, and exercises to get that muscle working normally again. Now, as you see, there's no bleeding, okay? Again, it's a fine filament needle. Now I'm going to just kind of do one more here. So you got a little tight spot here. Tap the needle in, it goes through quickly the sensory nerve ending so you don't feel the needle go in. And then here's where I do kind of the pecking. So I'm moving the needle. Now I hold on to that area just for a few seconds to get what's called homeostasis, so that if there is some bleeding underneath the skin, that it actually heals, does not bruise up. So now after we're done, we can kind of get that circulation going. You can kind of see how it's turning red here. Again, that's just new blood coming to the area to help with healing. Good. So there are no restrictions after dry needling. We want you to be moving. We want blood flow going, except we don't want you going out and overdoing anything. We don't want you shoveling a whole driveway full of snow right afterwards. We don't want you going to weight train heavy, but we do want you just normally being active. We don't want you to go home, rest, lay down, and think you can't do anything like post-epidural injection or something like that. Side effects, again, sometimes some bruising. Otherwise, you're going to have about 2 hours of bruisey soreness feeling, like someone hit you there. That dissipates out. For about the next day or two, you may have like a workout soreness, delayed onset of muscle soreness. So it felt like I did a lot of shrugs for Tom. It's going to just feel like he had a good workout in the next day or two. You can use ice or heat. If you feel like it feels a little swollen, ice is better. If you feel like it stiffens up, moist heat is better. That's our segment today. So if you have questions, you can write them down below, or please give us a call at either one of our locations in New Berlin or Greenfield.